There's really no question that telehealth has made enormous inroads since the beginning of the COVID pandemic. And the federal government, from Congress to HHS to DOJ, they have been and continue to pay really close attention to the telehealth space. The numbers have been revised over time, but in 2022, the Government Accountability Office noted that during the first year of the pandemic, Medicare, Medicaid utilization of telehealth services increased more than 10 times. Utilization went from about 7 million telehealth services in a year to more than 85 million in the first year of COVID. And that was just Medicare, and that was only the beginning. So what drove the increase? From a federal perspective, there were enormous changes in the regulatory framework, which included relaxation of the Medicare and HIPAA rules, and to a lesser extent, but still significant extent, the relaxation of DEA rules for the dispensing of controlled substances. All of this occurred at the beginning of the PHE in early 2020. And some key examples of that relaxation are, one, allowing patients to be at home for the telehealth service as opposed to actually having to travel to get telehealth. That sounds a little, I think, odd to us because we think of telehealth at this point as being at home and getting the service. That is an innovation. That was a COVID innovation. Another example is most telehealth services were limited to rural areas. That geographic limitation was gone. Certain in-person requirements that before COVID had to be satisfied before telehealth became an option, those requirements were gone. Really importantly, the number of healthcare services that were available through telehealth more than doubled. It used to be around 100 or so, and after COVID, more than 250 discrete services became available through telehealth. And there are many, many more examples, but I think this shows the cascade of changes that happened from a regulatory perspective so Americans could retain healthcare access through telemedicine. And this relaxation of restrictions on telehealth was extended almost entirely throughout the PHE. During the PHE, individuals suddenly had broad access to telehealth services in their homes, no geographic restrictions, few restrictions on the ways or the modalities that telehealth services could be delivered. And of course, the range of actual healthcare services were enormously expanded during that time.